I can't even understand what they're saying.
Watching a video about the French Revolution, 14-year-old Kylie Fannin struggles to interpret what she's supposed to be learning.
Yeah, it doesn't make a lot of sense.
In ninth grade at Glen Allen High School and forced to do virtual learning since March because of the pandemic, Kylie says much of her school day now consists of watching videos and trying to stay focused.
Tests and quizzes get harder, like just a bunch of things started going downhill, I feel like.
She's never had F's or D's, and now we have several.
Kylie's mom, Jennifer Farmer, says things really started to spiral in the fall.
And she just wasn't getting up out of bed. Her demeanor was different. She had a different attitude. She was just not happy, sad, not engaged, shut in her room a lot.
Kylie started exhibiting signs of anxiety and depression.
There was no motivation to do anything. I just knew once I couldn't see my friends and all this stuff that it was just everything just started I was just sitting in my room because there's nothing else to do, and it just kind of became an everyday thing.
Her virtual learning buddy Ripley Villa began to feel the same way.
Just kind of numb because you don't want to do anything. You just kind of want to sit there until it's over because you're realizing that there's not really anything you can do to fix it.
Balls up into this big thing, and it's just a lot of stress on you.
It's like a corn maze.
Yeah. Yeah, you're in a corn maze.
Yeah, you don't know which way to go.
So their moms took action.
We've had to explore some options that we've never really had to do before. Counseling. I collaborated with her pediatrician, kind of seeing is anybody else going through this? My kid just doesn't seem herself anymore. I've lost a big piece of her.
Kylie and Ripley now see counselors and take medications for anxiety and depression, all so they can survive virtual school.
We really saw a difference. She's getting up at 7:30 in the morning and coming downstairs and being more involved with the family.
And they're not alone. Data from Henrico County's Mental Health and Developmental Services shows a nearly 25% increase in the number of kids receiving services between July and November of 2020 compared to the same time period in 2019.
COVID has stressed a lot of families and children these days with virtual school, and I just believe less social interaction has occurred as a result and more isolation.
Dr. Randy Geldrich heads up the Pediatric Emergency Department at St. Mary's Hospital. He says they've seen more kids coming in with mental health issues since COVID-19 began.
They may come in because of panic attacks related to anxiety, or they may come in as a result of not sleeping well at night and simply being quite anxious.
Geldrich's team assesses the kids and decides if they can go home with a list of resources to help them or if they need inpatient psychiatric care.
The wait could be the same day to several days. It could be 4 or 5 days.
Kylie and Ripley did not need that level of care, but both say they'd feel better if they were allowed to be in school full time.
You guys want to go back to school?
Yes.
Yeah.
And I think that opening up the schools just as an option would help so many people in so many ways.
Jennifer Farmer just wishes Henrico families who want to send their middle and high schoolers back had that option now, as opposed to having to wait until February.
Would you feel comfortable sending her back to full-time school?
Absolutely. I would send her back to full-time school tomorrow if they told me it was open. We're creating a huge inequity. Families that can afford to send their kids to private schools are in school getting all the things that our kids are missing out on because we don't have a choice.
We checked with Chesterfield and Richmond to find out if more kids are seeking out mental health services in those communities. In Chesterfield, the number of kids seeking support through their community services board actually dropped when the pandemic began, and it has continued to decrease. A spokesperson said the schools are a major referral source for the CSB, and it's certainly possible that the lack of in-person contact with youth has impacted referrals. However, they added that the youth they are serving are reporting a significant amount of distress and have higher needs for care than they've seen in the past. Now, in the city of Richmond, the Richmond Behavioral Health Authority says fewer kids are requesting mental health services during the pandemic, But RBHA believes that is because many of the services they have offered within Richmond Public Schools for years have been curtailed or altered due to virtual learning. The COO for RBHA says they are working closely with RPS to identify youth who need services, and they are educating school personnel about their services. To learn more about what the superintendent for public instruction in the state of Virginia, Dr. James Lane, says the state is doing to try to address some of these mental health problems, visit this story on our website, WTVR.com. Working for you, I'm Melissa Hippolyte for CBS 6.
The American Academy of Pediatrics says the COVID-19 pandemic has taken a serious toll on children's mental health. CBS 6 wants to be a resource for parents and kids facing these challenges. In an effort to explore this issue and identify some of the specific challenges children are facing, we assembled a small group of mental health professionals and community members who have seen the impact of this firsthand. Dr. Sandy Henderson, a licensed clinical and developmental psychologist, says right now the level at which youth have been in mental distress is the greatest she's seen in her entire career.
And kids are feeling it in their body, and it's distracting them from their learning and from their social relationships and from their behavior.
Recently in Richmond, we saw dismal results in a state education assessment showing almost 2/3 of RPS students are falling behind. After a year plus of learning at home and abrupt disruptions in routine and structure, education is just one area where the mental health decline among kids and teens is exposed. The AAP says children continue to deal with fear, grief, and uncertainty. We've seen soaring rates of depression, anxiety, trauma, and loneliness. These were concerns before the pandemic, but the ongoing public health emergency has exacerbated them.
So we're at a crisis point. Now is the time to do something and to change something.
Sharnessa Pleasant, a licensed clinical social worker and therapist, says without realizing it, parents could be making the situation worse. Think about it. Have you ever been dismissive when your child does voice concerns or tries to express themselves?
It's the huge invalidation because what parents oftentimes may not be seeing is that your kid is responding to the chaos that's created in the environment that you're facilitating.
Experts say when kids don't feel heard, that can lead to harmful behaviors.
When kids are telling you, hey, I feel stressed, or you're not listening to me, I'm telling you how I'm feeling, then they're going to self-medicate.
That can manifest in many different ways, up to and including self-harm. According to the Children's Hospital Association, in the first 6 months of 2021, children's hospitals across the country saw a 45% increase in the number of self-injury and suicide cases in 5 to 17-year-olds compared to the same period in 2019. And according to the CDC, in early 2021, there was a nearly 4% increase in suspected suicide attempt emergency room visits among boys 12 to 17 compared to the same period in 2019. For girls, it was a more than 50% jump. Experts agree social media plays a role. Young girls may suffer from low self-esteem, body image issues, and even eating disorders, trying to achieve what they see online.
I could never win. I'm setting myself up every single day to feel like a failure because I can't live up to that.
A lot of people are dissociating from reality.
And I actually address this almost with every single person who comes into my office. Parents are unsure of how to start to control their children's usage.
Henderson says there are no solid, uniform guidelines or recommendations for families to follow on this issue, and everyone is addressing it individually in their own homes to varying degrees of restriction and access.
So we're all kind of like, flying blind.
Another issue, especially for children of color, is the reality of racism and racial prejudice. In that crisis declaration, the AAP and other groups said the ongoing struggle for racial justice is inextricably tied to the worsening mental health crisis. In a collective statement, the group said the inequities that result from structural racism have contributed to disproportionate impacts on children from communities of color. Pleasant says that may be hard to pinpoint for younger children.
I don't think that they have the language, but I think that they can always trust what they feel.
Other factors contributing to worsening mental health discussed in this group include kids and teens who might be struggling with their sexuality, bullying, home environment, and gun violence in neighborhoods or at school.
So the level of learning is totally impeded when they're worrying about their everyday safety like that. When they're full of anxiety and they're hypervigilant about what's going on and they're distracted by their anxious thoughts, how can they settle in and learn algebra? How can they sit there and concentrate?
This group agrees there are not enough services or mental health workers to support children in need.
Boots on the ground was said earlier. And you have to have boots on the ground, and that's where the gap is filled in.
And perhaps most importantly, government funding is lacking. Why is that? Licensed professional counselor Christina Rawls-Dolan has an idea.
So it's kind of like out of sight, out of mind. I can't see mental health, so we're not going to invest in this.
It's 2 against 1.
Mikhail Williams is at ease, tossing a ball around with his family in their Emporia yard. The 10-year-old has ADHD, and on this day, he has his medicine. But about a month ago, he ran out.
He shakes really bad. He gets like really bad shakes. His body movements shakes.
You could have caught that. I feel like I'm about to pass out and I get hot.
Mom, Michelle Penn, says Mikhail was scheduled to see a child psychiatrist at VCU Health Community Memorial Hospital Behavioral Health in South Hill, but days before the appointment, the office canceled because the doctor left the practice. She had just started in March, and there's no plans to replace her.
I did ask could they refill their prescriptions until I figure something out, but...
So what did they tell you?
No. It would have to been Dr. Anise.
Penn tried to get her son's family medicine doctor to write the prescription for the ADHD meds, but
she said that she had to get referral papers from the care building before she could refill their prescriptions.
There aren't any other child psychiatrists in the area, so Penn felt she had no choice but to take Mikhail to the emergency room.
Nobody likes to go to the emergency rooms, and we had to wait on a school night to get him medicine.
Mikhail's story is not unique.
They got Mario Kart.
Destiny Walls lives in Midlothian.
Mario Kart.
She says she's been trying to get her 6-year-old son Killian in with a child psychiatrist since January of 2019.
Everywhere's like a 6-month waiting list, and by the time that 6 months comes up, they call and they cancel, and you have another 6 months to wait. We ended up going to the ER because I wanted to get him looked at in a way.
This map from the American Academy of Child and Adolescent Psychiatry shows there is a severe shortage of child psychiatrists in Virginia and elsewhere. Here's Rachel Reynolds with the Virginia Mental Health Access Program.
Part of that is the amount of training and the requirements that it takes to become a psychiatrist. But the other piece of it has a lot to do with what insurance will bill for, what requirements there are within the state for licensure, things like that.
And the problem is just getting worse, with more and more children needing behavioral health services since the start of the pandemic. Nelson Smith is the Vice President of Behavioral Health for Chippenham and Johnston Willis Hospitals.
We've definitely seen an increase in volume in our pediatric and adolescent populations here. And I imagine it's just a scary thing to hear your child, if they were to say that they want to hurt themselves, you don't know what to do. And the first place that you think of is your community hospital, your emergency room.
According to a recent survey conducted by the Virginia chapter of the American Academy of Pediatrics, 90% of providers reported seeing more behavioral health issues since June of 2020. 82% perceived the number one concern for patients was having access to child and adolescent psychiatrists, and 62% did not feel they were able to meet the increasing behavioral health needs of their patients.
We do know that Virginia ranks 41st for availability of mental health professionals in our mental health workforce. And so we know that there really aren't enough psychiatrists or even other mental health providers to meet the growing demand that we have.
To try to help, a grant awarded to the Virginia Department of Health allowed the state to set up the Virginia Mental Health Access Program, or VMAP. Pediatricians and other frontline doctors that see kids can call VMAP and consult with a child and adolescent psychiatrist about a patient.
With a 15 to 20 minute conversation between the PCP and the psychiatrist, they can get the guidance that they need to send the family on their way instead of waiting 3 to 6 months to see a provider.
Reynolds says 648 providers registered to use the system, and the psychiatrist receives 6 to 8 calls per day. But there's still a need for awareness about the free program. It sounds like a lot of providers maybe don't know about the program.
Exactly. We know we need to do a lot more to get information out to the community about, to the primary care community about what's available to them.
Also a long-standing issue, access to inpatient psych beds for children, something Destiny Walls learned when she took her son to the Chippenham ER.
And I was like, well, is inpatient even an option at this point, because we've been fighting for so long? And they said, you would be sitting in the ER for 3 to 5 days before getting a bed.
There are kids that do wait several days. We're one of the few places that have child and adolescent beds. You have us, there's a place in Petersburg, there's just a big shortage of beds, I think, for child and adolescent.
So if there's a need, we asked Nelson Smith, why not add more beds?
Sure, I mean, that's a good question. I mean, there are lots of places that I think I don't know.
Felicia Wilson, the head of clinical services at Chippenham Psychiatric Hospital, Tucker Pavilion, said it would be hard to staff them.
Staffing has been extremely difficult during this time. I think a lot of our older staff have retired.
Which brings us back to Destiny and Michelle.
Go this way.
It's hard.
Who say more needs to be done to help kids in crisis.
I feel like, they should have more resources for the children.